My name is Mingo Ishmael Misime, and I work with the Universal Ministries. Well, today we are carrying out an elderly clinic day as one of the projects that we run among the 5 projects that we run. So the elderly clinic day normally happens every first Thursday of the month, and this is what is happening right now, as you can see. The Universal Ministries has been in existence for a couple of years, that is, to be specific, 15 years. And we have been running this alongside a couple of other projects. So the vision of our ministry is to reach out to the elderly and then empower their spiritual, physical, economic, and social aspects of life, hence making a better life for the elderly in Mukono and beyond. As we all know, most of the elderly in the country, world over, a couple of times are neglected in one way or the other, simply because of so many other factors, inclusive is their social statuses. So we normally render them being inactive in many aspects of life. We neglect them because we think they are inactive or they are rendered inactive. So that's why EPM came up, and amongst other activities that we do is also to improve their health aspects with various projects that we run, including what we are talking about right now. So into the elderly clinic day is when patients turn over onto the first Thursdays. We normally get a turn up of about 110 patients, 150 patients. That's normally the number that we expect within that day. So we arrange for them the environment, making the environment conducive for them. We bring the medical staff that normally will work, that a couple of times part of the BBM of Vietnam Municipal Ministry staff that come and minister the elderly through their health aspect. So we run a pharmacy, we run a doctor's session where patients come and are reviewed by the doctor. And then we also have a physiotherapy room where patients go for those chronic problems that they have regarding, back pains or musculoskeletal conditions, as well as eyes, sensory problems, eyes and ear problems that are very common with them, as well as chronic conditions to do with hypertension, diabetes, and the likes. So from there, when the patients, after visiting the doctor's rooms, they go to the nurses, or in case there is no part for nurses, they go to the laboratory, they do the investigations that are requested by the doctors and the clinicians. And then finally, they have to come back to us, just like a normal hospital cycle. And then they get to the pharmacies after making the prescription. That's where exactly they get their medication from. So from there, patients are also, sometimes they are given a bottle of drinking water just to make them relaxed, because a couple of them, for long distances to get from wherever they are up to here. So we believe that they need at least a glass of water to take before they relax and they are taking their vitals, like blood pressure, because quite often they come when they are stressed out because of the longer treks that they normally take. So after all that session, they are given a glass of water to take, and then they head back home. So normally we expect them to come back after 30 days. That's why we run it every after 30 days, that is on the first Thursday of the month. So besides that, there are several other projects are always running, like the clinic is always a stationed clinic. A patient can always come back. They don't have to wait for those 30 days to pass by. They can always come back for reviews, or if they are not having any problem, because we give them refills of their medications covering their 30 days. But nevertheless, a patient will always having some challenges midway there. They are always advised to come back and they get reviewed by the doctor.